Pinnamaneni SIMS is one of the finest healthcare research in Andhra Pradesh, India.
The social phase of medical education promoted by Siddhartha Academy has been commendable on every count. Regular rural health camps and referral sessions, super specialty medical treatment at a throwaway price, availability of comprehensive and state-of-the-art medical care, etc., hint at the fundamental approach of the Academy towards the needy and fellow citizens.
Biomedical waste management is an important issue in healthcare settings. We have well-equipped biomedical waste management in Pinnamaneni SIMS. We are doing it by generation, proper segregation, collection, transportation, treatment, and safe disposal. Biomedical waste generated within the hospital premises. The common biomedical waste generated in the hospital: all plastic waste, IV fluids, IV sets, Rice tubes, section catheter, GT tube, Eurobag, section vacuum set, Foley's catheter, 3-way cannula, syringes, containers, IV cannula, IV caps, hard clamp, gloves, section drive, discarded into the red bag. Waste generated into the yellow bag are placenta, cast pieces, cotton, pads, diapers, cap, mask, gown, apron, leg contacted gloves, discarded medicine, dietware, suture material, dead set,
Blood containers,
red contact syringe, discarded into the yellow bag. The waste to be disposed in the blue bag are glass bottles, medicine bottles, insulin bottle, ampules, discarded into the blue bag. The most common injury among healthcare workers is knee-stick injury, which can be prevented early if the shots are disposed properly into the puncture-proof box. Are needles, stillet, surgical blade, needles, unused slides, and plates. The waste to be disposed into the black color are kitchen waste, teacups, syringe covers, wrappers, plate cover, paper, cardboards, juice bottles, discarded into the black bag. These biomedical waste have higher risk of infections and injury to the patients, to all healthcare workers, and to the surroundings and community. For the purpose of safe disposal, for which we need to follow segregation practice at the generation site. In Pinnamaneni SIMS, we follow for 4 color coding system. To segregate the waste, they are red, yellow, blue,
puncture-proof box,
black. The waste disposed into the red bag are IV bottles, IV set, Lyles tube, section catheter, ET tube, Eurobag, section vacuum seat, plastic bottles, Romabag tray, gloves, card clamp, syringe caps, IV cannula, bag tenors, syringes, three-way cannula, Foley catheter. To be disposed into the red bag. Placenta, carton, gas pieces, pads, diapers, cap, mask, gown, apron,
blood contact gloves,
discarded medicine, guideway, suture material, blood bag, syringes, and blood contact bag tenors. Discarded into the yellow color bag.
glass IV bottles, medicine bottles, insulin bottles, ampoules, discarded into the blue color bag.
Needles, stillet, surgical blade, suture needle, unused slides, and used blades.
Dispose properly into the puncture-proof box.
Discarded into the black bag. Kitchen waste, teacups, syringe covers, wrappers, discarded cover, surgical blade cover, paper waste, cardboard waste, and juice bottles. Discarded into the black color bag. As we know, the biomedical waste are highly infectious and dangerous. They come serious damage to the society and environment. If it is not properly segregated and disposed of, so we kindly request you to follow proper segregation practices and help is in protective environment and health of community. To conclude, to waste of the not contaminated the lives of the healthy.
This is the point of segregation. Here the sanitary supervisors weigh and label the waste bags. These are transported in closed containers. It is essential that all biomedical waste products are segregated at the point of generation, and it should be appropriately treated and disposed safely. The waste collected from the wards are transported to the treatment center. Scheduled maintenance of the secured landfill area is done periodically by leveling, relocation, and closure of the craters. And one security personnel is posted in each shift to check any unauthorized entry or accidents. The area is monitored round the clock with the help of a 360-degree revolving camera. All the sharps segregated in the sharps container are collected and disinfected by using 10% hypochlorite solution. Then it is disposed into sharps pit, which is secured safely with a lock and key. This is a microwave. Infected plastics are treated here. It works between 9 a.m. to 4:30 p.m., covering 6 cycles per day. Each cycle lasts for 15 minutes duration. Around 10 to 12 kilograms of infected plastics contents are loaded into the machine for each cycle. It works by automatic process, and at the completion of the cycles, it casts out a slip with details of the cycle. After this, the treated plastics are cut into small pieces in shredder machine to prevent the reuse. We are having a well-equipped sewage treatment plant. sewage first enters the bar screen chamber, which is guarded by micron filter. The sewage then enters oil and grease chamber, where oil and grease are absorbed from the sewage before it reaches the equalization tank. Here bubbles are generated by blowers which neutralize toxic gases. Then it enters into the aeration tank. In secondary clarifier, the grinder rotates slowly at the rate of 1 circle per hour. The sand filter and activated carbon filter turns the content to clear water. This water then enters into the treated tank. The pH of the water in treated tank is maintained at 7. Strive to conform to the best practice of biomedical waste management in keeping with our motto of clean and green, and protect our employees, patients, public and the environment. Your health and environment is our motto.
Special thanks to Dr. Pinnamaneni Siddhartha, Institution of Medical Sciences and Research Foundation.